You've had gout before. You thought you were managing it. Then, out of nowhere, another flare hits. But what if I told you, your next gout attack was predictable, years in advance? A major new study in JAMA followed over 3,600 patients with gout for nearly a decade. The results are game-changing. That means that if your uric acid is above 5 or 6 mg per deciliter or 298 to 357 micromoles per liter, you're in the danger zone for future attacks, no matter if you are taking medication or an anti-gout diet. And it gets worse. The higher the level, the greater the risk, in a straight line. The risk of gout flares rises dramatically with every increase in serum uric acid. For patients with levels below 6 mg per deciliter, or under 357 micromoles per liter, the baseline flare rate is 10.6 per 1,000 person-years, with a relative risk of 1x. But once levels reach 6.0 to 6.9 mg per deciliter, the flare rate jumps 3.4-fold increase. At 7.0 to 7.9 mg per deciliter, flares are 6.9 times higher than baseline. And for those at 10 mg per deciliter or above, the risk is 11.4 times greater than those at 6 mg per deciliter. The message is clear: every single mg per deciliter increases your risk. And the higher your uric acid goes, the greater the danger. That's not random. That's biochemistry and biology. Gout increases hospitalization risk. When uric acid stays high, flares get worse, and more dangerous. Crystals solidify in joints to form gouty, ugly tophi. Not just joints, you run a risk of developing kidney stones, which may reach 1 in 4. The risk escalates with obesity and poor hydration. Gout is a chronic disease. Gout isn't a one-time event. It's a chronic metabolic disease caused by uric acid buildup. Once urate exceeds 6.8 mg per deciliter or 404 micromoles per liter, it starts crystallizing in your joints, like sugar-forming crystals in syrup. These crystals sit there until one day, your immune system attacks them. That's the flare. Your foot is inflamed, and you cannot walk on it. But here's the key. If there are no crystals, you do not have a flare. And no flares happen if urate stays below 5 to 6 mg per deciliter. Here is a myth-busting fact. I'm on medication, why do I still flare? Even if you're on urate-lowering therapy like allopurinol, if your blood level is still above 6 mg per deciliter or 357 micromoles per liter, you're still at high risk. This study found that medication doesn't erase the risk, urate level does. You're not failing. Your dose might need adjusting. Always test and treat. What should be your target? Guidelines differ slightly. US and Europe say treat at or above 6 mg per deciliter or 357 micromoles per liter. UK, British Society for Rheumatology aims for less than 5 mg per deciliter or 298 micromoles per liter for high-risk patients. For patients with chronic gout, such as those with tophi, gouty arthritis, or frequent attacks, the guidance, in all countries, is to lower uric acid and treat with a target of less than 5 mg per deciliter or 298 micromoles per liter. In review, stay under 6 mg per deciliter to avoid most flares. Aim for 5 mg per deciliter or lower to most eliminate risk. Here is what you can do. 1. Get your uric acid tested, not just once, but regularly. Your target is less than 6 mg per deciliter. Ideally less than 5 mg per deciliter. 2. Don't wait for a flare to adjust treatment. 3. Lifestyle helps, but medication is often needed to hit the target. This isn't about willpower. It's about precision medicine. Let us suppose you've just gotten your blood test back. Your uric acid is 7.0 mg per deciliter or 417 micromoles per liter, which is above target. You're determined to fix it. And you've heard, just change your diet. Cut out red meat, alcohol, soda. And you'll be fine. But here's the truth, diet helps, but it may not be enough. If your goal is below 6 mg per deciliter, this is the standard target to prevent flares. Diet and lifestyle changes can help. You might lower your levels by 1 to 1.5 mg per deciliter with extreme effort. Cutting out alcohol, especially beer. Avoiding red meat and shellfish. Ditching sugary drinks including juices. Eat whole fruits. Staying hydrated especially in hot weather and losing weight. But even then, it isn't easy to maintain long term. The result is often modest, and may still not prevent flares. And if you already have crystals in your joints? They won't dissolve unless uric acid goes consistently lower. Now, what if your doctor recommends less than 5 mg per deciliter, like many guidelines suggest for long-term protection? You were 7 mg per deciliter before. That's a 2 mg per deciliter drop from where you are. And here's the reality. It is highly unlikely you will reach 5.0 with diet alone. Studies show that even the strictest diet rarely lowers uric acid by more than 1.5 mg per deciliter. So if you're at 7.0, you might reach 5.5, but not below 5.0. And below 5.0 is where the real healing happens, where crystals begin to dissolve. Urate-lowering medication is necessary to reach and stay below the target. Drugs like allopurinol or febuxostat are proven, safe, and effective. Gout isn't just about pain today. It's about preventing permanent damage tomorrow. To do that, you need to keep your uric acid levels low consistently. For most people, this means combining wise lifestyle choices with medication to achieve the target. If you found this helpful, hit like, subscribe, and share it with someone tired of gout dictating their life.